I mean, you're telling a patient, okay, based on the complaints you have, based on my examinations and investigations, this is what I think you have, or this is what I've confirmed. Because sometimes it's a suspicion, sometimes you've confirmed your suspicion.
Okay.
This is what I've confirmed that you have, and the patient begins to say, "God forbid," and all those things are back to sender. Yeah, there's nothing I've not seen, my brother. It's on glasses.
Hello guys, welcome to another amazing episode of the Gist on Glasses podcast. It's such a great time to be back here again. I'm so happy because today we're going to have a very, very important conversation and a mind-blowing topic that I believe a lot of people don't know about that they need to know, you know. So first of all, welcome to Gist on Glasses podcast. This is me, your boy MC Mute, and of course, in the studio today, I'm not alone. I have somebody who is coming here for the very, very first time. I would like to make welcome Dr. Samuelson. Welcome very much. Thank you. Thank you for coming, sir. Welcome to the Gist on Glasses podcast.
Thank you very much.
Hi, how are you doing, sir?
I'm cool. I'm good.
That's nice. Nice to have you here. How's your week? How is work? How is family? How is everybody?
We're doing well.
Okay, so I would just like to go over his bio. He says Dr. K.C. Samuelson is a medical doctor and a healthcare advocate. He is a senior registrar in the Department of Obstetrics and Gynecology, Jos University Teaching Hospital, and a member of the West African College of Surgeons. He is married to his lovely wife, Sandra, and they have 3 children. That's a nice one.
My God.
So are we expecting more children? Have you got it to your limit?
I don't hang boots.
It's too early to
I leave it for you people.
we don't even have them. We're still on the way.
No, it's a matter of time.
Yeah, we'll get there surely. Me, I want to have a lot of children. Like, I want to have at least, if I not try, maybe 5. By the special grace of God.
Yes.
Isaac, what are you saying?
Yeah, a strong man.
Okay, so I would like us to just dive straight into the conversation. Today we're going to be talking about Rhesus factor.
Yeah.
RH factor. Now, this is something that I feel a lot of people do not know about it. Now, even me, it got to my awareness because a friend of mine made a movie about it. And so a friend of a friend sent the link to me and I saw the movie and I was like, okay, this is interesting. This is something that I'm hearing for the very, very first time. And I'm sure a lot of people do not even know what we are even about to talk about.
Yeah.
A lot of people don't even have
a clue
of what it is, you know. And because of that, you know, it brings the conversation of spirituality and whether it's a medical problem, because based on what it was like in the movie, it was more like they assumed that the character in the movie, he assumed that his wife and the mother-in-law, the both parents, they assumed that it was a spiritual problem. And a lot of issues we have in Africa today, in Nigeria today, we just assume that everything is spiritual. So we tend to, you know, to tilt to the spiritual perspective of life. We don't know that a lot of things are not spiritual, they're just biological. So the first question I'm going to ask today is, what is RH factor? What exactly it is, straight to the point, for the layman that's going to be watching us or people who don't know what we are talking about?
Well, let me first of all say thank you for the invite and thank you for talking about this issue, at least making people aware of it. Sometimes some of us in the medical field, because you know this thing for a long time, you think that everybody knows it. And you don't know that many people don't know some of the things. There's a real disconnect between the real information, right, and what people know. You know, when you invited me, I was speaking to my wife. Like you said, many people don't really know about. You know, when you sent me the invitation, I was talking with my wife about it, and I was like, and there are more interesting topics to talk about. But she opened my eyes to see that because I'm a medical doctor, this is information I've known probably for years. But there are so many other people on the street that don't, like you said, have never heard of it. for the first time. So she encouraged me that it was important for me to go and say what I know to help people gain understanding. Because when you have understanding, then you can make better decisions. But to answer your question directly, what is resource factor? Well, there are many types of blood groupings, let me say. Every individual has different types of blood groups, right? But there are two popular ones. And one of them is what we call the ABO blood group. And then there's the resource factor, which is another type of blood group. So those are the two popular ones.
Okay.
So the ABO is like when they ask you what your blood group is, you're either A or you're B or you're O or you're AB.
Yes.
Those are the four blood groups in ABO, right? Now, with those ABO, there's what the added resource factor, which is either positive or negative, right?
Okay.
So, so it can be A positive or it can be A negative. It can be B positive or it can be B negative. Okay, so the resource factor is that addition on the ABO blood group, and it simply has to do with what we call, it's a type of protein in the body that is called an antigen. Okay, so big words, but it's a type of protein in the body, right? So if your blood group has that antigen, the resource antigen, then you are positive. So you can, if your blood group A with a resource factor antigen present, then your blood group is A positive.
Okay.
But if you don't have the resource factor, right, on your blood group, then you are A negative, something like that. If your baseline blood group is A, and the same for B and O and the rest.
Okay.
Yes.
Okay. So this brings me to because I wanted us to have an understanding of what exactly it is that we are talking about, and you've been able to, to clearly explain, because most people are only aware of the first other type of blood group that we know, that they are B positive, like me, I'm B positive.
Yeah.
They are A, yeah, and all of that, and how how it usually affects. Okay, talking about blood transfusion and all of those things. So a lot of people know about that.
Yeah.
But a lot of people do not know about this second part.
Yeah.
That is the resource factor, the protein, and all of the explanation that you've done that I can barely understand some of them. And so the second question I want to ask is, how is it that a lot of people do not know or are not aware about these things? Like, how is it that there's a sensitization that needs to be done? Because it seems like a lot of people, I'm sure a lot of people will be like, okay, what are these people talking about today? And it has probably affected them or affected somebody that they know about, So how is it that we have little or no understanding of this particular thing?
Well, the understanding of the topic, really, many people are, will I say, not interested, because maybe sometimes some of these health topics are not interesting by themselves to seek for the knowledge, except, of course, you have an interest somewhat in it. And probably that's what is affecting people's knowledge of it, right? So, but I don't really blame people per se. There are a lot of things I don't know.
True.
You understand? There are a lot of things we don't know. And maybe except you are in the field or you have an encounter with such a thing, that will now make you go and dig in a little bit further to find out about it. So probably people don't know because they've not been sensitized, or they've not been in a position where they were affected by it, right? So that has not prompted many people to seek the information about it. So I don't know.
So how is it that it affects pregnancy? What is the relationship between this whole thing and pregnancy?
Well, that's I guess is the meat of why we're here.
Yeah.
When you talk about pregnancy, luckily I'm an obstetrician gynecologist, so that's my specialty, right? So when you talk about pregnancy and the resource factor, right? So like you say, your blood group is B positive.
Yes.
That means your blood group is B and you have the resource factor.
Okay.
So that's why it's B positive. I just wanted to chip that in. Normally, it doesn't affect pregnancy, but there's only one condition that it affects pregnancy, and that condition is when the pregnant woman herself is resource negative. Okay, so if a pregnant woman is O negative, B negative, A negative, that she doesn't have the resource factor, but her baby is resource positive, that's where there's a problem. I don't know if you get my point.
Okay.
So usually if a pregnant woman is resource positive, we don't bother. So usually when a woman gets pregnant, she comes to the hospital. One of the routine tests we do is that we must check her blood group. So if you are resource positive, we don't bother because you're not going to have any problem with that issue. Yeah. But once we've identified that the woman is resource negative, that means she's blood group whatever negative. So O negative, B negative, A negative, whatever negative. Then that brings us, we have to look out for that pregnancy. Now what happens during pregnancy is this. When the woman is resource negative and the baby is resource positive, a lot of things happen. Now, the body of the woman is resource negative. Her blood group is resource negative. If how do I explain this? I'm trying to explain it in a way that
layman terms.
Yes, I'm trying to. Okay, so there's something that happens, which is this: when a patient has a particular blood group. Let's say the patient is O negative. Let me use O negative now. So what happens is that the patient doesn't have the resource factor. Yeah. However, there's what we call antibodies, which are like soldiers that the body builds up to fight foreign organisms. Yes. Okay? So when a person is resource negative, it doesn't have the antigens, but it has antibodies against other type of blood groups. Yes. So if the mother is negative, say let's say O negative, but her baby is let's say B positive. Right? Normally, the baby's blood and mother's blood don't mix in the system when the woman is pregnant. However, there are some things that can cause crossing of blood from the baby to the mother or from the mother to the baby, usually from the baby to the mother. Now, if that happens, there are things that we call sensitizing events. So for example, if a woman has a miscarriage, right? She's pregnant with she's negative, resource negative, but has a baby that is positive, right? And then she has a miscarriage, right? That can cause blood to go from the baby to the mother, okay? Or she has, maybe she bleeds during the pregnancy for some reason. There are so many things that can cause a woman to bleed during pregnancy. If she bleeds, there can be crossing of the baby's blood into the mother's system. Do you understand? Yes. Okay. Or during delivery also. That's another event. It's a sensitizing, what we call a sensitizing event that can cause the baby's blood to get into the mother's bloodstream. Now, if the baby is positive and the baby's positive blood gets into the mother's bloodstream, remember that the mother is negative. The mother's body generates what we call antibodies, which are like soldiers that fight
to protect the body.
That fight to protect the mother's body against foreign, what it considers as invading organisms. So the baby's positive antigen now, resource factor, is the mother's body does not recognize it as part of its body. So it develops what we call antibodies to fight it. Okay? So that is essentially what happens. Now, why is that a problem? If a woman has a first baby that is resource positive, right? And she's resource negative, what happens is that the body develops those antibodies because it has been sensitized, like we said. It develops those antibodies, but it may not have enough to be able to cause any reaction for that particular pregnancy. The first pregnancy, that is the sensitizing pregnancy. Okay. And then, so the pregnancy may go well. However, those antibodies have been produced and they are stored in the system. Now, if the woman has another pregnancy, are you following me? Yeah. That is resource positive. The woman's body already has antibodies to resource positive. So when the woman gets pregnant, as the pregnancy is going on, right? The body releases those antibodies to begin to attack the blood of that baby that is being formed in the system. And so that can cause a whole myriad of problems for the baby. Okay, what it does is that it begins to break down the blood of the baby. So a baby in the womb can have anemia, low blood, because the mother's antibodies is breaking down the baby's antibodies. It has recognized it as foreign, as a threat to my life. So let's kill any invading organism. So it begins to break down the baby's blood group. The baby's blood starts going down. The level of the baby's blood starts going down. And the body of the baby starts trying to do what we call compensation. Tries to compensate, like, okay, my body is going down. I need to survive. Yes, the baby starts to try to survive. You know, and so a baby can have heart failure in the body. Wow. Yes, because of reduced blood. a baby begins to swell and eventually can lead to death. So the baby can die in the system because of this whole reaction in the body. So that's what we call hemolytic disease of the newborn. So that is why it's important to know this blood group issue. I don't know if you get what I'm trying to explain.
That's like a lot to take in, and from I like to reference back to the movie that I saw.
Yeah.
Because now we live in Africa, where a lot of information has not reached us per se. So a lot of people are ignorant about a lot of things. So you hear people who have challenges like this or similar challenges, or who have a totally different challenge and it is medically inclined. We now tend to want to spiritualize everything, So now, this is not to say that it is bad to be religious and all of that. But then I strongly believe that God has given us some sort of a lot of wisdom and a lot of knowledge for us to be able to make research and find solutions to problems. So it is not every problem that tends to be spiritual. Sometimes you just need to know the right thing to do and to take precautionary measures. So now I want to know, like, what are those precautionary measures that can be taken? Is there a treatment? Is it something that you can automatically treat and say, okay, this person is done with treatment, he doesn't have this challenge anymore? Or is it something that you have to keep doing, as maybe whenever the woman is pregnant or so? Is this something that you keep doing, or is there a one-time treatment for it and you are done with this thing?
Yeah, well, a very good question. The good thing about this matter is that it's not there's a cure, or should I say there is a way we can manage this. Okay, it's not totally a helpless situation. Yes. So if the woman has to be aware of her blood group, or at least when she gets pregnant for the first time, she needs to go and do what we call antenatal care in the hospital. Because when you go for antenatal care, a lot of investigations are carried out. And one of those investigations, like I said, is the woman's blood group. And once we pick that the woman's blood group is negative, it raises an index of, it makes us look out for this problem, right? So once the woman is pregnant and she's noted to be Rhesus negative, one of the things we have to do what we call a kind of surveillance of the pregnancy, right? So part of the things we do is that at intervals, we have to do a test called indirect Coombs test, an ICT or whatever. And so that test helps us to know if the woman has already been sensitized or not. Because some women may have had maybe a miscarriage or an abortion in the past that they didn't think was important, but they are Rhesus negative, and those things have already caused them to be sensitized, and their bodies have already developed those, what we call those soldiers, those antibodies, and they're just waiting for a Rhesus positive baby, and that can be a problem. So we need to do some screening tests if we discover she's negative. And so one of the tests is called an indirect Coombs test, aka ICT. We call it ICT, right? And so that tells us if a woman is sensitized or not, and we do it at different intervals in the pregnancy. Now, the management of this woman, how we treat this woman, depends on if she's already sensitized or if she's not sensitized. So sensitization meaning her body has already developed those antibodies, those soldiers. That's when we know she's sensitized, because we can pick it in the blood. Okay, but if the body has not developed any of those antibodies, she's not yet sensitized, and that's where it's safe. But if she's already sensitized, then there's a whole different management which I won't want to bore anybody with today. But if she's not sensitized, that's the good thing. So what we do is that we now have to follow the pregnancy. At intervals, we'll check, okay, are you sensitized or not? And if she's not sensitized, by the time she gives birth, there's a medication that we give. It's called they call it anti-D immunoglobulin. It's a type of medication that you give to the mother, okay? Because like I said earlier, giving birth is a sensitizing event. So the baby's blood can enter into the mother's blood, right? So when the woman gives birth, we take the baby's blood, first of all, and check the baby's blood group. If the baby's blood group is negative, like the mother, then no problem. Everything is cool. You are safe. But if the baby's blood group is positive, now we have to do something to prevent the mother from developing antibodies that will fight the next pregnancy. You get it? And so the medication we give is called anti-D immunoglobulin. So we give that to the mother. Okay? So when you give it to the mother, what that medication does is that it mops up any of the blood of the baby that has entered the mother. It clears it off before the mother can generate an immune response to develop all those antibodies and soldiers. So that's the good thing about it, is that if it's discovered on time and the woman is not already sensitized, we can give her a medication that prevents her body from developing those antibodies. You understand what I mean? Yeah. So that's the good thing about it. So every pregnancy must be...
You have to go through this routine.
Go through the same routine, because it's possible for the woman to have a Rhesus positive baby. So
the question I want to ask is, how equipped are our hospitals to detect some of this particular issue now? Because it's possible, like I made mention before, it's very possible that people have experienced or have gone through this certain problem and they don't even know.
Yeah.
They're not even aware that, okay, because it's one step, you are only one step ahead if you know that, okay, this is the problem that I have. But a lot of people do not even know that, okay, this is the problem. So they just live their lives, assuming that there's one demon somewhere that is affecting my life. Like I like to make reference back to the movie. He was saying that it's Ogbanje spirit.
Yeah.
And everybody would look at the person and feel like, this person has probably done something in their former life, or there's one cause that is coming from the village,
and it's just ignorance.
Yes, it's just sheer ignorance.
Yeah.
So how equipped are we to identify that? Because I want to believe that I don't know so much about medicine and all of that, but I want to believe that just looking by how we react to some of these issues in our societies, I want to believe that I don't think we are well equipped like that to know, because I'm very, very, very sure that a lot of people have suffered issues surrounding these things and they don't know the problem. So how equipped, how ready are we?
Well, I will speak on behalf of the general healthcare, let's say, industry in the country. Checking blood group is a very basic test. It doesn't take rocket science to check a woman's blood group, right? It's just, if you see where it's done, it's very basic. Even if you see it once, you can do it yourself. Do you understand what I mean?
Yes.
So it's very basic, and it's part of checking blood group is part of antenatal care. Okay, so any woman that is pregnant goes to a hospital for antenatal care will have her blood group checked. It's as basic as that. No, whether you go to the highest hospital, cadre of hospital, or you go to the lowest, it's the same routine tests. So regardless of the cadre of healthcare facility you go to, your blood group will be checked if you go to register for antenatal care. The problem is if you don't go, right? So the medication also, the anti-D immunoglobulin, is available. It's available. It's a bit expensive, but it is available.
That's another problem.
It's available, right? So if you look for it in any decent pharmacy, you should be able to get it. So I don't think the disease has gotten to a point where it really shouldn't cause any problem. Once you're pregnant, you do antenatal care, they discover your blood group is positive. Once your baby is born, they check your baby's blood group. If it's positive, they just give you the medication and you're safe until the next pregnancy. You understand?
You said it's more like the disease is, is it a disease? Can I call it a disease?
Well, the effect is a disease.
Okay.
You understand? But it in itself is not a disease.
So you're making saying the disease as it is, in quote, it is not something that should be a problem.
Yes.
Now the same thing can be said of cholera.
Yeah.
Malaria. You get I feel like civilized countries or other nations have gone past, like, if they hear that malaria still kills people in Africa, they'll be like, are you serious? Malaria? Meanwhile, it is mopping out a lot of people every day. So it brings this curiosity for me to want to really question, if we are that, are we that advanced that we can boldly say that this one is not, if we don't pass this level, it's not a problem anymore. Do you think we are that advanced that we can, because talking about malaria, cholera, typhoid, all of these things, it's something that till today it still affects us. In as much as in the general world, we should be able to say, okay, we have bigger fish to fry. Let us not worry or bother ourselves about little things like all of this. There are other bigger sicknesses that are out there that are rampant. There's cancer. There's, in fact, right now, some people will tell you that cancer is even more dangerous than HIV, which I tend to agree with, in a way.
Yeah.
So, but how confident are we to say that we don't pass this one?
Yes, like I said earlier, it shouldn't be a problem. I don't see why it should be a problem. The problem is the ignorance that people don't know, and probably the fact that the purchasing power of the people is a bit low, because if you do a little, some years ago I did a little research, and you've discovered that there are so many people that don't go for antenatal care in this country.
Are you serious?
There's so many, especially if you go towards the rural communities. Yeah. So there are many people who don't go for antenatal. You understand? And then some people that go for antenatal, then they don't deliver in the hospital. Do you understand what I'm saying? So the knowledge of the whole issue, that research I did showed that the knowledge of antenatal and the use of antenatal, it was in a rural facility in Kaduna State, in a rural place, community in Kaduna. And what we discovered is that almost 90%, 96% or so of women, let me land, 96% of women know about antenatal, they go for antenatal, right? Okay. But those that deliver in the hospital is less than 40%.
Wow, that's a lot.
That's a lot. So sometimes they go for antenatal, right? And they hear some of these things, but the practice of what they hear, because you now deliver at home, you miss that opportunity where find out what your baby's blood group is, and if you need to get that medication. Do you understand what I mean? So these are some of the issues, the dynamics that affect it. So ignorance, purchasing power of the people, the ability of people to deliver in health facilities, because you'll be surprised that delivering at home is still a very popular thing in rural facilities in this country, in rural communities. In this country. It's still very popular in this in this 21st century.
I don't know, I feel like people have funny reasons. Some people argue that it is safer. They don't trust the medicals. They don't trust the medical system. They don't trust this. And in fact, some people will tell you that our forefathers, how did they, we have stories of people who we know. Yeah. Who they'll tell you that, the mother went to the farm, and then, her water broke in the farm, and then she gave birth in the farm, and the child is okay, and all of that. So, to a large extent, you cannot completely blame them and say, okay, why are you saying that you must go to the hospital?
They know the stories of the people that made it our life. What of those that died in the process? We only know the stories of those that survived.
True.
Yeah. What of those that did not survive? Because, the whole process of pregnancy and delivery is a beautiful thing, but it can be very dangerous. You understand? Pregnancy delivery can be life-threatening. I know many women, this is my field. I know many women who have died because of pregnancy or because of delivery. So it's not something that we should take lightly, because, many women give birth. Yeah, but there's a percentage of women that will have problems during pregnancy and delivery. And that's why we do what we do, so that we'll be able to save those lives.
Wow.
Yeah.
Okay, so, we live in Africa. And we are very, very religious people in Africa. Very, very, very religious. And, of course, you go to church and you hear testimonies. This is just a jab at doctors. You will hear testimonies of people saying, the doctor was giving me evil reports.
Yeah.
How do you guys feel when somebody, maybe let's say somebody is what do I use now? Let's say somebody has cancer or something. Yeah. And you as a professional, you've done your scanning analysis of the person, and you're only telling the person what you are seeing.
Yeah,
that is wrong.
The
evidence of what is in your body. And probably the person goes to church, or the person prays, and God takes away I know that miracles happen.
Sure.
God takes away the ailments, and then the person comes out to give testimony, and the person is like, the doctors, they were saying I was not going to survive.
I'm telling you.
I survived. How do you guys feel? Like when you listen to it, you're like, okay, so shouldn't I do my job?
I'm telling you, it can be embarrassing. It can be embarrassing sometimes because you will not believe how many times that has happened even to me. You see, the doctor will give you an evil report. As if I don't believe in God. I mean, come on. I'm a Christian. So what I do is I don't want to compete with God. So
of course,
whatever you say in church, man, it's good for you. So, it's
I totally agree with having an understanding of both parties. Having an understanding of spirituality and also having an understanding of the medical practitioner.
Yeah.
Because there was a doctor in my church. I think he's left the country right now.
Mm-hmm.
And this is somebody who had a very, very high knowledge of spirituality. So when he is faced with a particular case and he has done everything medically, everything that he's supposed to do medically, and he's not understanding the situation, he finds a way of transiting into the spiritual, and he's able to command. And so you find other doctors who will just say, okay, no, I'm just a doctor, and all of that. So how is it that, still going back to that, because I really want you to hit on it. When people come and they tell you things like, okay, the doctor said I was not going to make it and all of that, and now, something happens. Does it make you feel like, okay, I was only doing my job, and yes, God has done it for you, but how does it actually really make you guys feel?
Well, there's almost no doctor I know that has not experienced that kind of situation. That you're telling a patient, okay, based on the complaints you have, based on my examinations and investigations, this is what I think you have, or this is what I've confirmed. Because sometimes it's a suspicion, sometimes you've confirmed your suspicion. Okay. This is what I've confirmed that you have, and the patient begins to say, God forbid, and all those they are back to sender. Yeah, there's nothing I've not seen, my brother. I tell you a lot of things. I mean, in that situation, for me personally, for me personally, I'm a Christian. I understand the place of spirituality. I understand the place of God in medicine. I mean, there are times, there's no time I'm facing a challenging situation. For example, dealing with a patient, I don't pray and say, God, help me to sort this patient out. Sometimes you're going in for a surgery, it's going to be difficult, and you pray and say, God, help me. In fact, there's no surgery I do without praying. On the table there, I say, we say a prayer before we put knife on skin, right? We say a prayer because we know that God helps us, through anything that we've got to do. And I mean, I faced situations sometimes that I didn't know what to do. Probably, I remember one time I was doing a surgery, and, sometimes when a woman maybe bleeds after giving birth, we call it postpartum hemorrhage, PPH. So sometimes you have to maybe operate the woman to be able to stop the bleeding. And so I remember one situation, I was in theater trying to stop a particular bleeding, was operating the woman, and the last resort for me was to remove the woman's womb so that it stops bleeding, so that she survives. But I didn't want to do it in that situation because this was a young woman that probably needs more children, and she was just bleeding from where we removed the placenta. So I tried everything in the textbook that I've been taught, and the bleeding kept going. And I just paused for 1 second. I said, Lord, help me. And an idea came to my mind. Once I did what came to my mind, I told my colleague that I need to go and write a textbook because the bleeding stopped, right? Because I did something that I've never read before. But it was an inspiration for me at that particular point in time. Because I tried everything. The only thing I had left to do was to just take out the man's womb. But at that point, I didn't want to do it. So I had to pray. And God gave me an idea or something I did. And the bleeding stopped. I closed the woman up and sent her back on her way. So I only say that story to say that I acknowledge the part that God has to play, right? And the pastors teach us that acknowledging a situation is not a lack of faith, right? The fact that you acknowledge that this thing is bad does not mean you don't have faith. Yeah. But you understand that, okay, this is where I am. So what can I do about it? Do I follow the medical line, or do I go and meet God and probably get a miracle or something? You understand? But just denying the obvious is not an expression of faith. You understand what I mean? So when people do that, I just know that maybe they don't have the understanding, the full understanding of what faith is and all that. So I mean, I don't want to ever be the one that interrupts a patient's faith. So whatever you want to do, a hospital is not a prison, and a doctor is not a policeman or a law enforcement agent. So our own job is to tell you what you have and what we think you should do, and it's your own decision whether to go along with us or to seek a different opinion. So
okay, thank you very, very much for such an enlightening and amazing time with you. It was a great insight. Like for me, I've learned so much, and I believe that a lot of people that are going to be watching this are also going to learn a lot from this conversation. So we're going to draw the curtain for today, and we hope that in the future, in the near future, if you have any medical situation, we're going to come here and we're going to answer us. So thank you, viewers. Thank you for everyone who has stayed tuned to us. Please subscribe to this YouTube channel. Drop your comments. If you have questions that you'd like the doc in the house to respond to, please you can drop it in the comment section, and we'll sure find a way to get those questions down to him and find a way to reach out to you. So thank you very, very much for staying with us. See you next time. Stay safe. Be good. Have a nice day.
Thank you.
Thank you.